Myocardial infarction, MI, more commonly known as a heart attack, is a serious medical emergency where blood flow to the heart is suddenly blocked, leading to damage in the heart muscle. Symptoms often include intense chest pain that may radiate to the arm, shoulder, or jaw, shortness of breath, and sometimes an overpowering feeling of anxiety resembling a panic attack. Ischemic heart disease, IHD, also known as coronary artery disease, CA, is a broader term for the condition when arteries supplying blood to the heart muscle become narrowed by deposits of fat and cholesterol, leading to reduced blood flow. While the treatment for MI typically involves restoring blood flow as quickly as possible using medications, angioplasty, or surgery, the management of IHD requires lifestyle modifications, medicines to improve blood flow, and sometimes procedures to open or bypass blockages. Risk factors for both conditions overlap significantly and include high blood pressure, smoking, diabetes, high cholesterol, family history of heart disease, and a sedentary lifestyle. To truly understand the nuances and distinctions between myocardial infarction and ischemic heart disease, here's a look at the detailed aspects of these conditions. Etiological triggers, sudden occlusion versus chronic progression. Myocardial infarction, MI, commonly known as a heart attack, usually results from a sudden and complete occlusion of a coronary artery, leading to the rapid death of heart muscle tissue due to ischemia. This event is often triggered by the rupture of an atherosclerotic plaque followed by thrombosis. Ischemic heart disease, IHD, on the other hand, encompasses a broader spectrum of heart problems caused by reduced blood flow to the myocardium over time, which may result in angina, heart failure, or arrhythmias. While MI could be considered a severe acute manifestation of IHD, the latter reflects a chronic condition, often developing silently over years, and can predispose to multiple episodes of myocardial infarction if not managed adequately. The distinction between these conditions is crucial as it influences the urgency of treatment and long-term management strategies. Clinical manifestation: acute severe chest pain versus gradual angina pectoris. Myocardial infarction commonly presents as sudden and intense chest pain, often described as a feeling of pressure, tightness, or squeezing in the chest. The pain can radiate to the neck, jaw, back, or arms, and is frequently accompanied by shortness of breath, sweating, and nausea. MI is essentially a heart attack, resulting from a blockage that stops blood flow to the heart, causing heart muscle damage. In contrast, ischemic heart disease, IHD, also known as coronary artery disease, typically manifests as angina pectoris, a chronic condition characterized by chest discomfort or pain that occurs when the heart muscle doesn't receive enough oxygen-rich blood. Angina is often provoked by exertion or stress and is relieved by rest or nitroglycerin. Angina alerts to the underlying problem of reduced blood flow but doesn't indicate immediate tissue death like in MI. Both conditions require prompt medical evaluation to prevent complications and optimize outcomes. Scope of cardiac damage: focused cardiac injury versus generalized myocardial stress. Myocardial infarction, MI, commonly known as a heart attack, is a medical emergency where blood flow to a part of the heart is suddenly blocked, causing tissue damage from lack of oxygen. MI is a localized event affecting a specific region of the heart muscle, typically resulting from the blockage of a coronary artery by a blood clot. Conversely, ischemic heart disease, IHD, is a broader term encompassing various conditions, including MI, that results from reduced blood flow to the heart muscle due to atherosclerosis of the coronary arteries. IHD can cause widespread myocardial stress over time, potentially leading to chronic cardiac conditions such as angina or eventually an MI, reflecting a spectrum of cardiac damage. Patient presentation: rapid onset of symptoms versus intermittent claudication. Myocardial infarction, MI, often a rapid onset event, typically presents as acute chest pain, often described as a sensation of pressure, tightness, or squeezing, and can be accompanied by shortness of breath, sweating, and nausea. It represents a medical emergency where heart muscle is abruptly deprived of oxygen due to a blocked coronary artery. In contrast, ischemic heart disease, IHD, a broader term encompassing conditions like angina, often manifests more insidiously. Intermittent claudication, pain on exertion relieved by rest, can herald this chronic condition where narrowed arteries reduce blood flow, causing recurrent but stable angina. Differentiation hinges on symptom onset and context, as IHD may eventually lead to MI if left unmanaged. Response to treatment: emergency intervention versus long-term management strategy. Myocardial infarction (MI) often demands immediate emergency intervention to restore blood flow and minimize heart damage. This swift action typically involves medications like thrombolytics, angioplasty, or even bypass surgery. In contrast, ischemic heart disease (IHD), a broader term encompassing conditions like MI, requires a nuanced long-term management strategy addressing the chronic nature of the disease. This includes lifestyle modifications, medications for risk factor control like statins, beta blockers, and possibly interventions to improve coronary blood flow. While MI is an acute, life-threatening event, IHD demands a sustainable, proactive approach to prevent future cardiac events and preserve heart function over time.